Hi everybody, welcome back to our office. And what I wanted to do right now is show on a model and demonstrate what periodontal disease is. We've talked about it, but this model I think is a great way to show exactly what periodontal disease is. So this is a model that represents health on one side and periodontal disease on the other side. And even though it's rudimentary, what we see in the healthy side is the gums are pink and firm and healthy looking, and then typically with periodontal disease the gums will be more red and swollen, and that's sort of what's represented here. You're familiar with when you go to a periodontist or a dentist, they make these measurements when they go around your mouth with this, we call it a periodontal probe. It's essentially a millimeter ruler to measure what are called the pockets. And so the instrument is gently placed between the tooth and the gum, as you can see here on the model, and normally it goes down to a depth of about 2 or 3 or sometimes 4 millimeters, and that's normal. What happens with periodontal disease is the gum starts to detach from the tooth, and when we put the instrument into the pocket, it goes deeper than 4 or 5, it goes sometimes 6, 7, 8. So the deeper it is, the more aggressive the periodontal disease is. And what it's measuring is it's measuring how much the gum is detached from the tooth. So if I were to lift the gums back, what we would see is on the healthy side, the yellow, which represents the bone, is right near the necks of the teeth, which is where it typically should be in health. And that's what we would normally like to see. But what happens with periodontal disease is bacteria and plaque accumulate on the teeth. First it starts above the gum line here, but it eventually migrates under the gum line, and it eventually forms some accretions on the teeth. We call it tartar or calculus, and that's hardened dead bacteria essentially, and it acts as a foreign body, and we need to remove it in order to cure the periodontal disease. So we do that a variety of ways that we've talked about. Sometimes we just use instruments to go under the gum and clean the material. The limitation is that we can't always go to the depth of the pocket with our instruments, and so that's sometimes why we have to do periodontal surgery. So typically when we do deep cleaning, we can clean down to 4 or 5 millimeters. Like in a case like this, it would be about halfway down, but we wouldn't be able to get to this material and effectively clean it. So that's what periodontal surgery is for. It gives us access to those areas. So we would make a small incision in the gum, and we would lift the gum back to expose this area so we can see it and clean it. And that's essentially what periodontal surgery is a way for us to access the roots of the teeth and clean the debris that's there. Once we've cleaned it thoroughly, if we can, sometimes we'll do something called a bone graft or use other materials to try to regenerate some of the bone. But when we're done, we'll then close the gum and then suture it back in place. So that's essentially what periodontal disease is and how it relates to and periodontal surgery and how it all kind of comes together.